Hi there, my name is Colleen Stiles Shields. It's my pleasure to tell you more about our recent publication, The Transition from Pediatric to Adult Healthcare in Young Adults with Spina Bifida, Demographic and Physician-Related Correlates. This work was conducted by researchers at Rush University Medical Center and the CHATS Lab, directed by Dr. Grayson Holmbeck at Loyola University Chicago. This work and researchers were also supported by sections of the National Institutes of Health, the Spina Bifida Association, the March of Dimes, the Cohn Family Foundation, and an R3 funding mechanism supported by Rush and RTI International. So to start, spina bifida is one of the most common congenital birth defects. It happens when there is a neural tube defect, meaning that the spine and spinal cord do not form properly within the first 4 weeks of pregnancy. The severity of spina bifida depends on the location of the spinal lesion. So for example, the sacral, lumbar, or thoracic levels of the spine. Spina bifida has been nicknamed a snowflake condition because each individual has a unique symptom profile. These symptoms overlap with chronic health conditions and physical and intellectual disabilities, which makes spina bifida a complex and challenging condition to manage. People with spina bifida therefore often need care from multiple disciplines. In the United States, pediatric patients tend to get this care in a single multidisciplinary setting. But as patients move into adult care, their treatment tends to become siloed by specialty. This means that adults have to visit multiple clinics to see different physicians from different disciplines, which makes for added complexity when it comes to coordination, communication, and care. And this complexity happens at a critical time. That's because adolescence and young adulthood is a high-risk time period for medical non-adherence, which is a term describing when one doesn't follow their treatment plan exactly as prescribed. With spina bifida, non-adherence can quickly lead to life-threatening complications, so the stakes are pretty high. The transition to adult healthcare during this critical time period would therefore ideally be seamless. However, there's a lot about this process that we do not know. We therefore conducted an online national survey to characterize the transition to adult healthcare for young adults with spina bifida. The Spina Bifida Association, which is a national voluntary health organization in the US, supported our recruitment, sharing the study link on their website and social media pages to help us recruit young adults who met these inclusion criteria. Before diving into our findings, it's important to note that we recruited participants prior to the onset of COVID-19 pandemic in the US. We've identified in another study how the pandemic has impacted young people with spina bifida and their families. But in this current study, we found that the majority of participants saw an adult primary care doctor as their primary physician. Specialty providers were more often adult practitioners as well. Based on our criteria, about 3/4 of the sample had transitioned to adult health care. This group tended to be younger and to not have a shunt. The younger age of those who had transitioned may reflect an emerging generational effect, since there's been a stronger emphasis on transition in more recent years. Whereas the shunt status finding might highlight that the cognitive challenges associated with having a shunt may make transition a bit trickier. About 1/3 of participants who had transitioned to adult health care said that they had to return back to pediatric care at some point. Those who stayed in adult health care without this return tended to have myelomeningocele, the most severe form of spina bifida, to describe their employment status as being full-time student, and again, not having a shunt. The findings suggest that characteristics specific to spina bifida might be at play, so transition plans might benefit from factoring those in. For example, providers could help their patients with shunts to come up with contingency plans for a possible shunt malfunction. It's also important to assess individuals with spina bifida for their readiness to transition. The Spina Bifida Association recommends that assessments and planning begin early, between the ages of 12 to 17. We were ultimately happy to find that many young adults with spina bifida had transitioned to adult health care. However, we also identified several ways in which some people might struggle. We hope that future research can examine more nuances and obstacles of transition to adult care, so that best practices to support young people with spina bifida around this critical healthcare transition can continue to improve. Finally, please be sure to see our paper for more findings about medical care and transition for young people with spina bifida. Thank you very much.